Well, COVID-19 is already crippling the country. Now, medical experts are warning of a twindemic, COVID-19 and the flu. Pediatricians are pushing to better protect our kids. We're facing a twindemic. Two dangerous and deadly respiratory viruses are likely to slam the country this season. COVID-19 cases potentially on the rise, but experts also forecast a potentially severe flu season on the horizon. It's a perfect storm that could wallop an already overextended healthcare system and bring a wave of even more casualties. Go-to guy Dr. Anthony Fauci has been urging people to get the flu shot. And while COVID concerns dominate the headlines, facts about the flu are being forgotten. Pediatricians say influenza is of greater concern to our nation's children than COVID-19, resulting in more hospitalizations, serious complications, and deaths. When it comes to fatalities, 121 children have died from coronavirus complications, while the number of pediatric deaths from the flu was more than double that, the highest on record since 2009. And this season, several hundred more kids are expected to die from the flu. With worries of double infections and so many unknowns, doctors urge parents, now more than ever, schedule flu vaccinations for their children. But will they? And here with the flu shot facts you need to know is Chief of Division Pediatric Infectious Diseases at UPMC Children's Hospital of Pittsburgh, Dr. John Williams. Dr. Williams, thanks for joining us today.
Thanks for having me.
So why are pediatricians kind of freaking out about the fall with the flu shot, COVID? What's happening?
Yeah, so we're concerned as pediatricians because we already know that kids are not getting their routine vaccines the way they should because of offices being closed down, people being concerned to go to the doctor. So we're seeing routine childhood vaccinations being given at lower rates, and parents should get their kids to their doctor to get their vaccines. The other problem with the flu is that there's this pervasive belief among the public and among sometimes physicians and healthcare workers that, well, it's just the flu, it's no big deal. I think people need to realize 10 to 12 million kids in America a year get the flu.
So you look at how damaging the flu can be, and then you think about COVID, and then you say to yourself, wow, this is a scary word maybe, twindemic?
Yeah, so I think there's a few things that are really concerning about the twindemic of having COVID and flu at the same time. In fact, in children, it's not rare that they're infected with more than one respiratory virus. We're not really sure what it will do for children to have influenza virus and coronavirus at the same time, but based on other viruses, it's certainly not going to make the disease less severe.
When you look at data, which is more concerning for kids, COVID-19 or getting the flu?
In this country, every year, several hundred children die of influenza, and most of those children are previously healthy, and most of those children were unvaccinated. And in fact, the children hospitalized with influenza in this country, 3/4 of those children were previously healthy. So there's an enormous unappreciated burden of severe and even fatal disease of the flu in otherwise healthy kids. Coronavirus, there have been severe and sadly even fatal cases in kids, but the number of those is a lot lower. And most of those kids were actually older teenagers, closer to adult age, and most of them had underlying conditions. So they really have a very different effect in kids.